Hello friends, now we'll be discussing a topic that is development of bladder and bladder extrophy. So before starting, I would like to thank Chandana Shri Ma'am for sharing these wonderful notes which are very helpful for quick revision, and the link for the notes is given in the description below. You can download it from there or my Telegram channel. So without further delay, let's get started. So bladder develops from the urogenital sinus or the bladder analgae. So there's a urorectal septum which comes down from the uh, mesodermal central part of the mesoderm, and the anterior part to the urorectal septum forms the urogenital sinus from which the bladder develops, and the initial part is called the bladder analgae, and the posterior part develops as the hindgut or rectum. The cloacal membrane, which is the membrane which closes the common outlet of the urethra and the anus, on merging of the septum, it converts into urogenital membrane and the anal membrane, and anteriorly it develops into a bladder and posteriorly it develops into a rectum. So this was about development of the bladder. Now coming to bladder extrophy. So if there is abnormal overdevelopment of the cloacal membrane during the 4th week of gestation, it is prevented by the mesenchymal tissue medial migration, and this prevention prevents of the proper lower abdominal wall development. So this defect, lower abdominal wall developmental defect, that is prevented, causes bladder extrophy, that is ectopia vesicae, where the bladder is communicating to the environment, cloacal extrophy, and epispadias. These can occur in different variants of extrophy epispadias complex. In the classical bladder extrophy, there is defect in the abdominal wall, bladder, genitalia, pelvis, rectum, and anus. Now we will be seeing in detail the bladder extrophy. So here the abdominal wall, there will be a triangular defect caused by the premature rupture of the abnormal cloacal membrane, and it is occupied by the extrophied bladder and the posterior urethra. The facial defect is limited inferiorly by intrasymphyseal band or the urogenital diaphragm. Upper end of the facial defect is up to umbilicus, and there is increased incidence of indirect inguinal hernias due to decrease in the obliquity of the inguinal canal. Then they also have anorectal defects in the form of short broad perineum, anteriorly displaced anus, and posterior limit of the anal defect at the posterior level of the anal defect, and then they have imperforate anus in the form of rectal stenosis or rectal prolapse. So these are some of the anal issues like the anteriorly displaced anus, short broad perineum, imperforate anus, rectal stenosis or rectal prolapse. The male genitalia, this patient will have epispadiasis, then chordae, that is dorsal chordae, or shortened urethral groove. In females, there will be short vagina, which can be anteriorly displaced, and bifid clitoris. Urinary defect in the form of hematomas and neuromuscular dysfunction. Now coming to the diagnosis, most of the time these can be diagnosed prenatally in the form of absence bladder filling on ultrasound, low set umbilicus, widening of the pubic ramus, small genitalia, and lower abdominal mass. On examining the newborn, there could be defect in the size quality of the bladder template, extent of the pubic diastasis, length of and wide of the urethral plate, penile length, and associated anomalies. All these things are to be evaluated on examining the newborn. So lastly, how do we treat these cases? The bladder closure and reconstruction is done. It can be done as a single procedure or a staged procedure. And what are the components of these repair? We go for primary bladder closure with or without osteotomy. bladder neck reconstruction, repair of the abdominal wall defect, penile reconstruction, that is epispedia surgery, and ureteric reimplantation. So all these things are done in the bladder closure and the reconstruction, and bladder extrophy is managed in this manner. So this was all about bladder extrophy. Please like, share, and subscribe if you have liked the video, and never give up, because great things take time. See you soon in next video, and keep studying, keep growing, because knowledge is power. Thank you.